Many people want to have a baby with a certain genes. For example, they want to have a girl so they can wear cute clothes, or they want to have a boy so they can be a family protector. How to get a girl or boy pregnant? Here's what the doctor said. Do you know that the baby's genes is determined by the chromosomes carried by the sperm? Men have chromosomes XY, so the sperm produced can carry chromosomes X or Y. Women have chromosomes XX, so their egg cells always carry chromosomes X only. Well, the baby's genes is determined by the combination of these chromosomes. If the sperm that succeeds in fertilizing the egg cell carries chromosome Y, the result is a boy. But if the sperm that fertilizes carries chromosome X, the result is a girl. Statistically, the probability of having a girl or boy is 50-50. Then can we increase the chances of having a baby with a certain genes? Well, there are several methods that are claimed to increase the chances of having a boy or girl. But until now, this method is still a debate in the medical world. One of these methods is known as the Shettles Method. The principle of this method is based on the difference between sperm X and Y. Sperm Y has a smaller, faster-moving character, but weaker and easier to die in an acid environment. Sperm X is bigger, slower-moving, but longer-lasting and stronger in an acid environment. Based on this difference, a strategy was developed to increase the chances of having a boy, for example, by regulating the time of sexual intercourse. If you want a boy, try intercourse during ovulation because sperm Y can reach the egg cell earlier. And it is recommended not to intercourse 4 to 5 days before ovulation. If you want a girl, try intercourse 2 to 3 days before ovulation so that sperm X, which lasts longer, has a greater chance than sperm Y. Ovulation is when the ovarium releases the egg cells that are ready to be fertilized. Ovulation time usually occurs around 14 days before the next first day of menstruation. If the Hades cycle of a woman is regulated for 28 days, then ovulation occurs on the 14th day after the first day of menstruation. But if the cycle is longer or shorter, the ovulation time can also change. In addition, the condition of the vagina also affects the sperm that manages to survive to fertilize the egg cells. Shettles' method recommends washing the vagina before having intimate contact with baking soda solution for a wetter environment if you want a boy, or vinegar solution for a sourer environment if you want a girl. But be careful, this method risks disturbing the balance of the vagina and increasing infection. So it is still debatable and requires consultation with a doctor first. In addition to that, other literature states that eating habits also affect the condition of the vagina. If you want to have a boy, mothers are advised to consume high-nutrient foods such as salted fish, red meat, salted eggs, and high calories such as bananas, avocados, mushrooms, and tomatoes. Avoid consuming yogurt and cheese. Meanwhile, if you want to have a girl, mothers are advised to consume high-calorie foods such as milk, cheese, and high magnesium foods such as spinach and jelly. Avoid drinking soda. This eating habit should be applied 3 months before having sex for optimal results. Those are some ways that are claimed to increase the chances of having a boy or girl. But this method does not guarantee 100% results and is still a debate in the medical world. If you want more accurate results, you can use medical technology such as IVF with PGT, pre-implantation genetic testing, which allows the selection of embryos based on the type of sperm before being planted in the womb. There is also sperm sorting, i.e., the method of separating sperm X and Y before insemination. However, this procedure is generally done for medical reasons, not just personal preference. Apart from the type of sperm, the main thing is that the baby grows healthy and happy. Do you think it's better to have a boy first or a girl first? Write in the comments column. Thank you for watching this video.